Assalamu alaikum and good evening. Thank you, organizing committee, for inviting me, especially Dr. Suhail. Today, we are going to review some findings in CVT. Before I start, I will show you 6 cases. So please take a look. The question is, which one of these has central venous thrombosis? Take your time. So actually, all of these cases have central venous thrombosis. So that's why I'm presenting on this topic to give you some hints and clues so you can diagnose the venous sinus thrombosis when they have so much different appearance. So this will be basically a pictorial review. We are going to take a look at 22 cases and we come up with some pattern or clues to the diagnosis, complication of chronic central venous thrombosis, and couple mimics of CVT. So here is the first case. As you know, this is a typical finding in a hemorrhagic venous infarct. You see one hemorrhage here, one hemorrhage here. I call this like a interrupted or laminated pattern. So you have a hemorrhage, almost normal brain, and other focus of hemorrhage. So whenever you have this kind of appearance, look for hyperdense vein or a hyperdense sinus. So again, here you see the hemorrhage. So here is a cord sign. You can see this linear hyperdensity in a vein. On the cross section, it is right here. So this is your venous thrombosis, cortical vein thrombosis. Here is the sagittal routine image of the CTV. We don't see almost anything, but you have to adjust the window, and now you can see the clot right in the superior sagittal sinus. So again, when your suspicion is high and you're looking for central venous thrombosis, make sure you change your window to a wider window so you can look through this hyperdense artifact here. Here it looks almost normal, and here you can clearly see there is a filling defect in the superior sagittal sinus. Here is the second case. Almost looks like similar to the last one, that this patient has multiple hemorrhage, which I call interrupted hemorrhage, laminated hemorrhage, and there is a normal brain parenchyma in between. So this is highly worrisome or suggestive of venous infarct. So whenever you have this kind of hemorrhage, again, look for hyperdense vein or a hyperdense sinus. And you can see in this patient right here, this is a hyperdense cortical vein. If you look at the other images, you can see here. So this is what we call as cord sign. So again, if you have an interrupted hemorrhage, laminated hemorrhage, look for a hyperdense vein or a hyperdense sinus. So as you know, these patients are treated with heparin. They can develop a lot of edema, but after 3 months, you can see most of the findings are gone. Another case, on the same theme, there's a hemorrhage. Again, it is interrupted hemorrhage, normal parenchyma in between the hemorrhages. So this is highly suspicious of venous sinus thrombosis. MRI can be confusing. Actually, this patient has a breast carcinoma and they send the patient to rule out metastatic disease. You can see edema here, and you can even see some leptomeningeal enhancement or vascular engorgement, can easily be confused with metastatic disease. On the MRI, the images without contrast are very helpful. So here you have the sagittal T1 and then the MRV. Our goal is to diagnose these cases before we do the MRV. And here you can see on the T1, there's a hyper intensity in the superior sagittal sinus, and here there is a non-filling of the superior sagittal sinus. So these are the 3 cases. So this is our first pattern or our first clue to the diagnosis is interrupted hemorrhage. They almost looks like the same, only the size is different. So whenever you have this interrupted hemorrhage, look for hyperdense vein or hyperdense sinus. So here is our laminated hemorrhage. On the MRI, again, it can be confusing. You have a hemorrhage here, edema here, it could be anything. On the MRI, beside T1, these gradient echo images or SWI images are important. Normally, the veins are hypointense on gradient echo, but not to that extent. And if you look here, these veins are larger and these are more hypointense. This is similar to the cord sign on CT. So this is another case of venous, like the cortical venous thrombosis and venous hemorrhagic venous infarct. So case number 25th, on the T2 weighted image, there's a hemorrhage here, some edema here. This one is different from the other cases. Now we have bilateral findings. But the particular thing about this is these findings are in the parasagittal location. Again, on the gradient echo image, you see the hemorrhage, normal area in between. You see the hemorrhage here, some peripheral diffusion restriction. Here's some diffusion restriction, and then the normal area. So when you have a parasagittal hemorrhage or parasagittal edema, make sure you look carefully at the superior sagittal sinus. And here you can see on the post-contrast MRV, here is a normal superior sagittal sinus, and here is the filling defect in the superior sagittal sinus. And here on the 3D weighted images, you don't see the filling of the superior sagittal sinus. So I added this case for this second pattern. If you have a bilateral parasagittal hemorrhages, look for superior sagittal sinus. This case is a kind of very tricky. It came as like a cold stroke. Patient has some sudden onset of symptoms. If you look at this case, someone can think this patient may have an MCA infarct. Here is the normal density of the caudate nucleus, lentiform nucleus, thalamus. If you go here, you don't see that density. Even the lentiform nucleus here is less dense as compared to this one. So some can easily diagnose it like an arterial infarct or MCA infarct. But if you take a look carefully, there is this hyperdensity in the vein here. And here you can see in the thalamostriate vein coming here, it is hyperdense as compared to the other side here. On the coronal images, you can see this bilaterally. Here, this vein is hyperdense. You can see again here it is hyperdense, and then these two veins are hyperdense here. On the MRI, it can be confusing. There's only bilateral caudate edema, some lentiform nucleus edema, maybe subedema of the thalamus here. Venous infarct can have some diffusion restriction. So there are some areas of diffusion restriction, some facilitated diffusion. Here you can see some area of diffusion restriction. Again, the same finding, but what is helpful here, if you look at here, in the internal cerebral vein, you can see a diffusion, kind of diffusion restriction. So that is one of your clue. You are looking at a central venous thrombosis. On the T2 weighted, the FLAIR images, you see the edema in the caudate nucleus, here's the lentiform nucleus, caudate, the thalamus here. But the clue to the diagnosis is, look at the veins here. So this is hyper intense. Like it should be dark like this, like superior sagittal sinus. But due to the clot here, you can see hyper intensity in the veins. The gradient echo is helpful. There's a hemorrhage. So whenever you have a hemorrhage in the deep gray matter nuclei, look for venous infarct and venous sinus thrombosis. And again, here on the gradient echo images, you can see this thalamostriate vein coming here. This is hypo-intense, and it is larger as compared to the other one. This is CT without contrast. You can see hyperdensity in the vein of Galen. You can see hyperdensity in the straight sinus. And this is a CTV. And you see there is no opacification. These veins are opacified. This segment of the straight sinus is opacified, and there's a filling defect. But our main goal is to diagnose before we do the CTV, because many times this diagnosis is not suspected. Again, on the MRI, on the pre-contrast T1, you can see this T1 hyperintensity. On the gradient echo, there is a blooming in the veins here. Okay, case number 7. This patient also came as cold stroke. And the only finding here, you can see there is a subarachnoid hemorrhage. On the MRI, this looks almost normal. There are some findings. On the sagittal T1, there is this little hyperintensity. Is it real or it is a thrombosis? It's possible. It can be superior sagittal sinus thrombosis. This image is key. Whenever I'm evaluating the venous sinus thrombosis, I look at this non-contrast coronal image and I compare the density of the transverse sinuses and the superior sagittal sinus. If you look carefully, as compared to the transverse sinuses, the superior sagittal sinus is hyperdense. So that is the best clue that this patient has venous sinus thrombosis. Some people use some density numbers. I don't use that. It depends upon patient hematocrit, how well the patient is hydrated. I like this internal criteria of comparing the transverse sinuses and the superior sagittal sinus. So this differential density of the superior sagittal sinus is very worrisome of sinus thrombosis. Of course, we are going further to do CTV or MRV to confirm it. But again, we have to diagnose this on non-contrast plain CT. So here is the MRV, CTV. We don't see anything. As I said before, you have to change the window. So you change the window here, and now you can see there is a filling defect in the superior sagittal sinus. So I will show you more cases in just later on of this sign of differential density in the different sinuses. Okay, here's another case. Again, you can see typical venous infarct-like hemorrhage, laminated, interrupted hemorrhages. In this case, the cortical vein were okay, superior sagittal sinus was okay, but still this pattern is worrisome. So if you have this kind of a pattern, look hard for any other vein which is thrombosed. This is quite a unique case. Here again, you see multiple typical interrupted hemorrhage. I don't see any density in the superior sagittal sinus. I don't see any cortical vein, but still our doubt is very strong given this pattern without any trauma that this is venous sinus thrombosis. If you look here, this looks like maybe a subdural hemorrhage along the fox, but it is very tubular. And then there are some branching structures which are hyperdense. This is a non-contrast CT. You go more further here, you see again, this is hyperdense. And you see all these branches, these are hyperdense and they are connecting to this structure. Here again, you can see multiple. So these are not the cortical vein on the convexity. So these are the vein along the medial surface and they are draining into this area here. If you go inferiorly, you can see this hyperdensity, which looks like a subdural hemorrhage. Only thing it is tubular and it is only on one image. So this is very concerning for venous sinus thrombosis. So which vein is this? So in a second here. So right here, you can see this round structure. So it is not a paraphalcine hemorrhage. This is a thrombosis of the vein. I will go through, so just scroll through this area here. Here you can see incomplete hyperdensity. And again, you see that venous infarct and you see this thrombosis of this sinus. This is after 11 days. And now it has become less dense, but it is expanded. And you can even see here. So this is a CTV, and now you can see there is enhancement around it, but there is a filling defect. This is again, here you can see a filling defect. So which vein is this, or the sinus? So here again, you can see laminated hemorrhage only on the one side. Here is that tubular structure here. And here you can again see the tubular structure. On the T2 weighted image, it is here. On post contrast, here it is filling defect. So this is the thrombosis of the inferior sagittal sinus. And this is a follow-up exam after the treatment. Now it is smaller, almost collapsed, and you don't see it here. So this is the normal anatomy. You see here's the inferior sagittal sinus. It goes to the, along with the vein of Galen to the straight sinus. So this patient presented with a large clot in the inferior sagittal sinus and all those tributaries which are draining into the inferior sagittal sinus. Okay, this is also a tricky case. Looks like a lot of edema. There's only one focus of hemorrhage. It can be anything. The patient may have injury, patient may have a hypoxia, some other problem. So this is the coronal image. So whenever you have a hemorrhage, edema, look for this coronal image. This is hyperdense. This is hyperdense. This is not hyperdense. So when I have this differential density, I'm concerned about venous sinus thrombosis. So this is thrombose, and this is normal. So we have to confirm it with any vascular study. So this is a conventional angiogram. You can see there is no opacification of the superior sagittal sinus, no opacification of the right transverse sinus, only the left transverse sinus is patent. So that's why this patient has that extensive edema. So if I go back again, so this is the importance of looking at this non-contrast coronal image, where you see all those three sinuses. So look for this differential density. Another case, hemorrhages, bilateral, parasagittal. So what we are going to look at? We are going to look at the superior sagittal sinus. So you see here, it looks like there's some high differential density in the superior sagittal sinus, and here it is non-filling. So this is another case of superior sagittal sinus. Just to emphasize, if there are bilateral parasagittal findings, look at superior sagittal sinus. Case 11, this patient came with headache. So there's a fluid in the sphenoid sinus. There's a diffusion in the sphenoid sinus. So this diffusion restriction is usually seen with acute sinusitis, although can be seen with some proteinaceous secretion. So this patient headache may be due to sinusitis. But if you look at the next image, there is this diffusion restriction. Where it is in the cavernous sinus. So that is highly suspicious of cavernous sinus thrombosis. So this is a post-contrast image, and now you can see there's this filling defect, this filling defect, this filling defect here, and there are multiple filling defect here. One is the third nerve. So this is a cavernous sinus thrombosis due to sphenoid sinusitis. So whenever you have the classification of sphenoid sinusitis, look at cavernous sinus. This is a follow-up exam. They did the surgery and drained the sinus. Now you see the diffusion restriction is gone in the cavernous sinus. All that filling defect is gone. So another case number 12, this patient came with the fever, mastocytitis, confusion. You can see there's a fluid here. So whenever we see diffusion restriction, we are worried about abscess or the pus. Here you can see there is a bony erosion of the sigmoid sulcus. And here the patient already have empyema. Again, you can see the empyema on the flare images, empyema on the diffusion weighted images. It is pus, has diffusion restriction. Here the post-contrast images, you can see multiple empyema. So whenever you have mastocytitis, look at the transverse sinus on the same side. If I look here, I don't see anything, but again, I have to change the window. If we change the window, now you can see there is a filling defect in the left transverse sinus, superior sagittal sinus, and the right transverse sinus is okay. So what is the lesson from this case? If you have a mastocytitis, make sure you look carefully at the transverse sinus, change your window, and document the patency of the transverse sinus. And here of the same patient, hard to see on this image anything. We change the window and you can see the filling in the sigmoid sulcus or the sigmoid sinus. This patient has a surgery. So whenever there's a posterior fossa surgery, I look very hard at the transverse and the sigmoid sinus. I cannot see anything here. This is our friendly coronal image. So compare the sinuses. If this one is dense, and then on the CTV, there's a filling defect. So again, I use internal reference, normal density, and this is hyperdense. Although normally we can see hyperdensity like this in a sinus, but the point is this differential density. So whenever posterior fossa surgery, look for this patency of the transverse sinus or sigmoid sinus. And here you can see on the T1, this is a clot here. On the T2, you can see clot here. Okay, so again, you can see there's a non-filling of this transverse sinus. Case number 14, this patient has bilateral edema. It looks like a press, or it could be like a SLE, some vasculitis, something else. It's bilateral posterior, patient has headache. So same thing as you do on the coronal CT, you also look at the coronal MR for the signal in the sagittal sinus. Here it is dark on T2, which is normal signal. This one is not dark. So this is the thrombosis of the superior sagittal sinus presenting as bilateral parasagittal vasogenic edema. And here on the MRV, it is confirmed. The main thing is to diagnose before MRV, because if you suspect something on those images, then are you going to order the MRV or the CTV? Case number 15, there is an edema in the thalamus, could be infarct, could be encephalitis. If you look here carefully on the gradient echo images, there is a blooming in the vein. So that is concerning for a central vein thrombosis. Again, our friendly diffusion images showing us diffusion restriction in the internal cerebral vein, flare image showing the signal in the same area. And here on the T1, you can see the hyperintensity. And here you can see there is a non-opacification of the vein of Galen, straight sinus. On the pre-contrast T1, here you can see hyperintensity. Even on the CTV, you don't see the opacification of the right thalmostriate vein. You see the opacification on the left. Same thing here, you don't see this vein on the coronal image, you see the opposite side. And they treated with heparin, and on the follow-up, you can see almost the findings are resolved. So it's kind of a strange unilateral presentation with one side thalmostriate vein was thrombosed. This patient has a subarachnoid hemorrhage, came from, I think, outside hospital, if I correctly remember. So they sent as a subarachnoid hemorrhage. But if we go here again, our coronal image, we see some hyperdensity right away. So that is suspicious for transverse sinus thrombosis. So this is our friendly coronal image. So compare it here. So here is even the parenchymal hemorrhage. So this vein is hyperdense as compared to the superior sagittal sinus, as compared to the right transverse sinus. So the left transverse sinus is hyperdense. We can even see on the parasagittal image. Now you do the CTV, and you can clearly see there's a filling defect in this transverse sinus. Again, look at these coronal images. So outside exam, which they send as hemorrhage, they did everything. They did CTA to look for the cause. This is the image from their scan. If you look at here, you can see this sinus is hyperdense, and you can diagnose venous sinus thrombosis. Actually, they did this all CTA, all this 3D reconstruction. They say the CTA is negative. Patient has a subarachnoid hemorrhage. On the most of the CTA, the venous sinuses are opacified. Even from their scan, if you look here, the left transverse sinus or the sigmoid sinus is not opacified, and the right one is opacified. So this is another typical case of interrupted hemorrhage. So it is parasagittal, look for the superior sagittal sinus. Here again, interrupted hemorrhage. Here you see some cord sign or a hyperdensity here. On the sagittal non-contrast images, you can see the hyperdensity in the superior sagittal sinus. Here again, our friendly coronal image. You see the hyperdensity in the superior sagittal sinus. Both these sinuses are normal. So this is highly suggestive of venous sinus thrombosis. And here you can see the filling defect in the superior sagittal sinus. So case 18, we'll go quickly through those cases. So these are bilateral hemorrhages. So when bilateral hemorrhages, look at the superior sagittal sinus. So here is it's hyperdense posteriorly, normal density anteriorly. Even this transverse sinus is hyperdense. And again, our friendly coronal image shows you the sagittal image. There's a non-contrast. There's a clot in the superior sagittal sinus. And here's a non-contrast image show you there's a clot here. Even there's a clot here. And this is the normal sinus. And this is a CT, we show you the same thing, the filling defects here. And this patient has COVID. So we have seen quite few patients who have a COVID, and either they have an arterial thrombosis or a venous thrombosis. For the case 19, so again, the same concept, interrupted hemorrhage, look for sinus, and here is a hyperdense sinus. And here again, you can see this sinus is hyperdense and larger as compared to this is more hypodense. This is I'm showing to this, for this purpose, this patient also has subarachnoid hemorrhage. This patient has this hemorrhage. It's non-specific on the MRI. On the MRI, on the gradient echo images, we look for similar to the cord sign on CT. See here, superficial middle cerebral vein. This is hypo-intense on gradient echo image, so it is thrombosed. This is a case was done for a thyroid nodule. This is the last cut through the brain image. You can see edema here. Sinus looks normal. Here again, you can see hemorrhage, and there is edema here. So the MRV was done. There was this defect, and you can think about that this patient may have a venous sinus thrombosis, and that led to that edema and hemorrhage. So again, the transverse sinus looks patent here. There's a filling defect here, which could be venous sinus thrombosis. On the MRV, there is a non-opacification, but this transverse sinus is opacified. There's an additional finding here if you look hard. Here's a opacification of transverse sinus. There's a blush here. I don't see that blush here. So this is something else. So we go you more here. Again, on this image, you see the blush here. You see the kind of enhancement here. There's no enhancement here. If you go the MRA images, normally you should see the arteries, not the veins. You can see the bilateral ICA, basilar artery. But if you go here, you see some small veins in the region of transverse sinus. So why the transverse sinus has arteries inside it? So again, more MIP images, you see some arteries next to the transverse sinus, even some arteries within the sinus. So on the MIP images, you can see this artery going to the transverse sinus. Even the transverse sinus has some hyperintensity, which should not be there on MRA. On the MIP MRA image, this is not an MRV, it is an MRA image. You can see these arteries or some veins coming here, and then there is some mixed signal intensity in the transverse sinus. So what is this? Here is the DSA, and this is dural arteriovenous fistula secondary to chronic thrombosis. So here you can see some arteries, here you can see some opacification of the veins. So when you see a filling defect, so the treatment is different. If it was sinus thrombosis, we would have patient on the heparin. Now this patient has to go for angio and embolization. So make sure when you don't see the venous sinus, there is no DAVF. So look at your MRA images. On the post-contrast MR, you will see normal opacification of that sinus. Okay, so second last case, I think. So you see a filling defect here. So this is an outside patient. Patient came with a headache. They saw this filling defect. They diagnosed it as a venous sinus thrombosis. So here is this exam. You see the right side, there's a filling defect. There's a filling defect. I don't see that blush. So it is not a dural arteriovenous fistula. So this looks highly worrisome of a venous sinus thrombosis. Again, here on the MRV, there's this large defect up to here. On the coronal T2, it is hyperintense. Clot can be hyperintense. And here you can see this is hyperintense here, it is hyperintense here. I'm not showing you the other images. On every image, this was CSF signal. So the clot cannot be CSF signal. You can see here, it goes from all the way here to the here. So this is your arachnoid granulation, which is a normal finding. Normally these are small, just like this, but sometimes they can be large. So make sure if you don't see a sinus or you see a filling defect in the sinus, take a look at your coronal T2. If it is very hyperintense, look at your T1, look at your rest of the images. It can be a large granulation, which can be as a venous sinus thrombosis. Okay, the last case here, again in the transverse sinus, there's a filling defect. So is it arachnoid granulation? It is not CSF signal. This is CSF signal, but this is not. So this could be sinus thrombosis. If you look at the coronal image, again looks like a filling defect here, which is not CSF. So what is this one? If you go look at this image, if I go back, you can see the brain parenchyma is herniating into this region. So this is basically encephalocele within arachnoid granulation. I have multiple cases. If you look for it, you can find it. So again, here, again on this one image, on the FLAIR and T1, you can see how the brain parenchyma is going into the transverse sinus within the arachnoid granulation. Again, here you can see the white matter going here, the gray matter going into the transverse sinus. So before you call venous sinus thrombosis, make sure it is not arachnoid granulation, it is not encephalocele in the arachnoid granulation, or it is not a dural arterial venous fistula. So here is my last slide. So what the take-home message? So what are our clues and patterns? Interrupted hemorrhage. This is a big clue. So if you have an interrupted laminated hemorrhage, look for venous sinus thrombosis. On the coronal CT image, if there is a differential hyperdensity, one or two sinuses are hyperdense as compared to the other one, your suspicion should be very high for venous sinus thrombosis. Look for cord sign, hyperdense vein, hyperdense sinus, and on the gradient echo images, hypointense vein. If there's a bilateral parasagittal hemorrhage, this is another clue to the diagnosis of venous thrombosis. So look at your superior sagittal sinus. Focal subarachnoid hemorrhage, as I show you one or couple cases, it can be with venous sinus thrombus. Normally, the convexity subarachnoid hemorrhage localized, we see with amyloid angiopathy, we see with cerebral reversal constriction syndrome, reversible constriction syndrome, and add this third to your diagnosis. If you have a focal hemorrhage, think about venous sinus thrombosis. If you have an edema or hemorrhage in the bilateral basal ganglia, in the thalamus, look for central veins. If you have a sinusitis, if you have a sphenoid sinusitis, look at cavernous sinus. If you have a frontal sinusitis, look at superior sagittal sinus. If you have a mastoiditis, look at the transverse sinus. If there's a surgery in the vicinity of the sinus, make sure you look carefully on that 3D or the coronal image, reconstructed image, to make sure there is no differential density. And again, if the patient has a parasagittal, unilateral, or bilateral subcortical vasogenic edema, look at the patency of the superior sagittal sinus. With that, thank you.